Dr. Rodgers at Fertility Centers of Illinois. I often get asked by my patients whether it is better to use an outside agency to help them with the gestational carrier and egg donor, or whether it's better to use on-site help with the clinic. And I think that's a personal decision. I think that there are a lot of people who do both. So the first step is, of course, getting eggs, and those can either be frozen from an egg bank or through a fresh egg donation. And you can either work with the clinic. Most clinics who do a lot of gestational carrier work have their own inside agency. You almost can think of it as their own agency. At our office, all of those egg donors are already screened. So there's an extensive FDA required and then fertility screening process. They have infectious disease screening, they have psychological screening, medical health screening, and thorough genetics, fertility, the whole works. And those patients have already passed the patients who are in our pool of egg donors have already passed those extremely rigorous testing and are able to be, are good candidates. A lot of times, potential egg donors or gestational carriers for that matter have not had all that testing when you're working with an agency. They want to do it. They seem like they're good candidates on paper, but they maybe haven't had all of the testing yet. So it's hard because you could really, really want a specific donor or a specific gestational carrier, and then they may disqualify. So that is something to consider. Also, a lot of the agencies do charge a fee just to sort of access and use them, although they are kind of one place that can help coordinate your care. It's important to be with a clinic who does this a lot, and a lot of times people will use, for example, egg donors through the clinic, but then maybe a gestational carrier through the agency, and it's important to sort of talk to your doctor and ask them what their advice is, because every clinic and every part of the country world is a little bit different. So it's a really personal decision. I think both are good options, and it's really a personal preference on working with an agency to help coordinate or working directly with the clinic.